Welcome to Medical Marijuana and Wellness. Today's topic is dosing with medical marijuana. Very important subject to get the most out of your medical cannabis experience. Joining me today is Amy Green. Amy, thank you for joining us.
Of course, Mark. It's always nice to be here.
Let's talk about dosing. What we're really trying to do is get the most out of the cannabis products that we're buying. Tell me about the different components that we're trying to take advantage of.
Yeah, certainly. So cannabis itself is made up of several different parts. There's going to be three major ones. You'll have cannabinoids, and there's big cannabinoids like THC and CBD. Then you have terpenes. Terpenes are what give cannabis its smell and its taste, and are also giving it a lot of the beneficial components. And then finally, you have flavonoids. Flavonoids also contribute to color, taste, and the smell of the product. And they're also bringing in a lot of really helpful benefits as well.
Yeah. And the amazing part about cannabis is by combining all three of those together, you're getting something called the entourage effect. These are where they work together to enhance really the medical efficacy of the product itself.
Yeah, absolutely. So when you combine all of these different parts of the cannabis plant together, they are working together to give you the most benefits. So that's why having THC on its own without terpenes or flavonoids isn't necessarily as beneficial as having all three together.
Sure. And so we're talking about dosing. So let's just jump right into it. One of the fascinating parts about cannabis is its biphasic.
Yeah. And so this means that you can have too much, and it means that we're trying to find a therapeutic dose. So what I mean by this is as I am increasing my dose, there is a spot in that line of increasing it where I have the relief that I'm looking for, but without unwanted side effects. And if I go past that sweet spot, there are, possible negative side effects from having too much cannabis.
Right. And your physical size doesn't make any difference. I mean, you can be very small and have a high tolerance of THC. You can be very large and have a low tolerance of THC. It really just depends on your metabolism. Is that correct?
That is so true. Yeah. And it really depends on how you use cannabis. So if you consistently use lower dose products, you're going to have less of a tolerance than somebody who's using high dose products.
Sure. Now, here's a great example of, we talk about combining both THC and CBD together. Here's a study that really made this, that makes this point very clear.
Yeah. And so in this one, the THC only group is using approximately 27 milligrams of THC daily, while the CBD and THC control group, they were using approximately 60 milligrams total of both of those compounds together. However, the group that was using CBD and THC together had superior reduction in pain. So this is really showing how powerful putting CBD and THC together can be.
Sure. And that's really an important point to be made. Now, what we're trying to do is find our sweet spot. What is the sweet spot?
Yeah. So as I said, it is finding the lowest effective dose to allow you to have the benefits that you're looking for, whether that is anti-anxiety, anti-inflammation, pain relief, whatever you are trying to treat with medical cannabis, it is the lowest effective dose without unwanted side effects. And that side effect that we're usually trying to avoid is that stoned, heady feeling. We actually don't want you to get to that point. We want to try and find that sweet spot before you get to that point.
Yeah, what you're really trying to find is what your tolerance is to THC. So let's talk about that a little bit. There are different factors that control, as we mentioned, that control how much cannabis each of us takes. It has to do with really our bodies and not necessarily our size, because pharma drugs will just be prescribed based on weight, but cannabis is a little bit different. It really has to tie into a number of different things like your metabolism and medical condition.
Certainly. And just like you said before, it does not matter the size of the person. It's completely based on how that medication is working for that patient. And often we'll say what's working for one person is not guaranteed to work for another person. And this is why, because you have so many differing factors from person to person. A big part of that is your endocannabinoid system. That's the naturally occurring cannabis system in your body. Your body naturally makes cannabinoids. And when we are using cannabis products, we are supplementing that system. And how our personal endocannabinoid system works is absolutely going to differ from person to person.
Right. And the route of administration, meaning how we take it, the amount of dose, the cannabis content, cannabinoid content, all have a factor here. We'll be talking a little bit more about this as we go along. But you talked about titrating up and actually titrating down. Explain that to us.
Sure. So when you are titrating a dose, this means a dosage change. That's all titration means. So we always want patients to start at a very low dose and then slowly work their way up until they are actually in that target range where they're having relief with no side effects. Now, when we say toxic range, what we mean is it is a non-therapeutic dose. You've passed the point of having the relief that you're looking for, and you can actually have unwanted side effects. That may be a return of pain, that may be anxiety, that may be that stoned heady feeling, but that is a non-therapeutic dose, and it means you need to titrate your dose down to bring it back into that target range.
Right. I mean, one thing about cannabis that's interesting is more is not better. And that's what we're really trying to show out here is you take it, you may not necessarily feel, let's say, the relief that you're looking for. And also you may get some negative side effects, which is what you talked about earlier. It's down here.
Yeah. And when we talk about negative side effects, they really kind of fall into two different groups. So you have your mild negative side effects. That might just be a fast heart rate, dry mouth, red eyes, dizziness, anxiety, or that couch lock feeling where you don't want to get up and do anything. And then you have the more severe side effects from using too much. That might be some paranoia, difficulty standing, that overwhelming sense of just the world is too much for you, and then difficulty staying awake. And again, these are all effects that we're actually trying to avoid by finding the correct dose.
Sure. And so when you start feeling, especially when you get over here, that's why go low and go slow is important, because you'll probably experience some of the mild side effects first before you get to the severe ones. And so as you begin to feel that, just back down, take less of the product. You're not going to necessarily, in fact, what it'll do is it'll help you get the relief you need, but to avoid the side effects. And this is really the key to dosing. That's what makes dosing really important. Really key is to understand listening to your body. Your body will tell you when you're beginning to feel relief. Your body will tell you when you're not feeling good. I know a lot of people say, well, give me a formula. Tell me what I should take. Give me how much of this, how much of that. Really, we can't do that because you really have to listen to your body. Every person's body is different. Some people, for example, you take alcohol or caffeine. Some people take one drink and they're kind of done for the night. And some people could drink the whole bottle and they're just getting started. Mm-hmm. With cannabis, you really have to find out where your tolerance is to THC. Once you do that, then you can increase the amount of CBD and you can get yourself into an area where you can actually find that, what they call that therapeutic dose. So listening to your body is really, really key. There is no formula that a doctor can give you. It's not like take 2 pills and call me in the morning.
And that is exactly right. Now, since the last slide did say toxic dose, we just always want to reiterate that there is no chance of overdose with cannabis. You will get that high, stoned, heady feeling that will go away with time, but there are no lasting impacts, and there's been no overdoses ever with medical cannabis.
Sure. I mean, you'll feel uncomfortable, but you're not going to die. I think that's the key. A lot of the pharma drugs that are out there, it's amazing to me, especially when you're watching TV, they tell you all the side effects. And the last one is always, you're going to die. I mean, from eye drops, that really is amazing. But anyway, the point is no one has ever died from the use of cannabis, either medically or recreationally. So I think that's fairly safe. You may feel uncomfortable, but it's fairly safe with respect to the death area. Now, we talked about going low and going slow. Explain that to me.
Yeah. So again, it's just starting very low and then slowly building up to a point where you actually have the relief that you're looking for. So when we are working up to that optimal dose, we are looking at how much THC we're using, how much CBD we're using, what terpenes, so the smell and taste of the product that has been beneficial for us.
Mhm.
And then there's just some things to consider as well. So we know that cannabis compounds can be stored in the fat cells of the body for 30 days or more.
Mhm.
That does not mean, though, that you're going to feel the effects for 30 days or more. That just means that the byproducts of using cannabis are going to be stored in your body, but without giving you any effects.
Mhm.
The other thing is cannabis loves fat. So we actually always recommend using cannabis products with food, and with a fatty food is even better. Something
Right.
like peanut butter, yogurt, something that has a good amount of fat in it. And
Right.
then
It'll
finally,
help you. It'll help you quite a bit. It'll help you bring out the benefits of cannabis when you use that.
certainly. And then this is what I love, journaling to know what cannabis products you've taken, how often you're taking it, what dose works best for you, and really looking at a full 24 hours for yourself. Do you need to take something morning, noon, and night? Or with your symptoms, do you only need to take something once a day? And
Right.
this is really where it depends on the patient.
Right. I think also we recommend that if you're titrating or you're using THC or a combination of ratio of THC, it's important to have a bottle of CBD around.
Certainly. The nice thing about CBD is it does not have any psychoactive effects to it, and it will counteract the psychoactive effects of THC. So if you take a dose of THC that gives you that heady, uncomfortable feeling, taking an equal amount of CBD can help bring down that headiness and just make it more comfortable. All of the effects are not necessarily going to go away, but it will definitely be more comfortable than having that high stoned heady feeling.
Right. I think that's very, very important. Is that we call that a rescue product. So
Yes.
so let's talk about the process that you go through. I know you usually a lot of people start with a tincture oil using a 1-to-1 ratio. Why don't you walk us through this? Because this is very, very important. Really,
It
our
is.
goal is to start at about 2 milligrams of THC. And walk us through this because this is not complicated, but it is a process.
It is a process, yeah. And this is just determining how concentrated the tincture that you're using is. So the idea is you want to find out how much of that product you should be taking to get the benefits that you're looking for. But in order to figure out how much you're supposed to take, you need to do just a little bit of math.
Mhm.
So say, for example, the packaging of your tincture says that there's 250 milligrams of THC in that bottle, and that bottle contains 30 milliliters of liquid. So you're going to divide 250 milligrams by that 30 milligrams, and you have roughly 8.33 milligrams of THC per milliliters. Now, if I wanted to start at 2 milligrams of THC for my dose, I would be using approximately a quarter of a dropper. Now, the concentration of your tincture might be different, and the volume of that bottle might be different. And so it's just really important to have both of those numbers, both how many milligrams of THC are in the bottle total, and then the actual volume of that bottle. If you have those two numbers, you will be able to figure out how much you should be taking to get to that starting dose.
Right. It's not overly complicated. It's just there is a process where you figure out the milligrams per milliliter, and then that'll translate into how much of the eyedropper to start with, especially if you're starting with a titration product like a sublingual type of thing, which I recommend is the place to start. It's probably the easiest to control. But we'll talk about other routes of administration as well. Now, you talked about journaling. I think that's really, really important. Tell us a little bit about that.
Yeah, so when we talk about journaling, we want to objectively look at how the product is working for us. So when we are looking at our journal, we want to know what product we're using, how much we used, when we took that product, when we started feeling effects from that product, how long those effects lasted for, what symptom relief we had, and then would we use that product again? Was it effective for what we were trying to treat? And then when you go back and look at how that product worked for you, you can see, well, I took this dose, it lasted this long, and it was moderately effective for me. So I'm going to slightly increase my dose and try again with another journal page and see how that dose works for me.
Right. And this is very effective. I know it is a bit, how should I say, tedious to be able to write a lot of this down, but it really makes a huge difference to be able to know day after day. Again, you're feeling a little bit better, but why are you feeling better? That's the key to journaling. It's there.
Absolutely.
Now, there's some tips we have. So to make it a little bit easier, we have a journal that you can download. There's a bit.ly link down here. And by the way, you'll get that in the email follow-up to this particular video. But here's a key. Talk us through the different parts of this journal.
Yeah, and so this is just looking at using a product from the very beginning. So it's how you're feeling beforehand. And there is a section there for any symptoms that you're experiencing. So say your problem that you're trying to treat isn't necessarily from pain, mood, or anxiety. Say it's something else, it's a little bit more specific. Just write down how you're feeling. And then you're just going to note the product, again, how much you took, when you took it, the time that you first felt the effects, and then did it help with what you're trying to treat. One part of this journal that I especially like is that there is a section in the very center that's duration. So that's how long that product is going to last for you. This is really important information when you're looking at a 24-hour treatment plan. So if you know that this product that you use works for 6 hours for you, then you kind of have an idea, okay, so about every 6 hours, I should be taking a dose.
Sure.
And that's,
I know in my particular case, I have herniated discs in my neck. I have 7 of them, which is a lot of pain. And I know that, like, for example, the sublingual drops I take in the morning, they say they work between 4 to 6 hours. In my case, they work for about 4.5 hours.
Mm-hmm. Yeah, and that's establishing the duration. Once you have that information, it's a lot easier to make a long-term plan of what's going to work for you.
Sure, it's there. Okay, so let's take a look at, again, once you find that sweet spot, once you say, okay, I'm listening to my body says I'm beginning to feel better at this particular point in time, you can actually increase the amount of CBD that you use to be able to really enhance the, let's just say, the efficacy of the cannabis product you're taking.
Certainly, yeah, because THC and CBD work better together. Once you found your therapeutic dose for THC, by adding more CBD, you're not reducing any of the effects from the THC. You're just increasing the benefits from the CBD, while also probably reducing any headiness or unwanted stone feeling that you may be experiencing.
Yeah, and I know in my case, I found that by increasing the amount of CBD, so I'm using a product that's a 4-to-1 or an 8-to-1, that reducing of inflammation, which is what CBD is really known for, reduces the amount of pain. I found that it's not just a matter of going after the pain itself, it's going after what's causing the pain, which is the inflammation. And by reducing that, it really helps quite a bit. And that's what a lot of people will find, that increasing the amount of CBD will probably help them get better relief. Now, let's talk a little bit about the routes of administration. We talked about sublingual drops over here. There's also other ways. For example, some people may want to start using gummies, edibles.
Yeah, so gummies are a very popular way to start just because they're very easy to dose. Generally, I always recommend starting with a quarter of a gummy. Wait 45 minutes to an hour and a half to see how you feel with that dose. And if you're not feeling anything from that dose, it's okay to take another quarter, but that's going to be your dose adjustment for that day. The next day, when you're taking a full dose, you could actually start at a half of a gummy instead of the quarter, because you've already established that a quarter of a gummy is not going to be effective for you.
Right.
And like that, you can increase or decrease the dose based on how you're feeling.
Sure. And also, topicals really aren't a really good way to start figuring out your dosing level because they act so quickly. But inhalation is. Some people could try using either concentrates, flower, or an inhalation vape pen.
Certainly. The biggest thing with any vapes or concentrates, generally, the standard dose is going to be a 3-second inhale. I would usually recommend starting with a half second or 1 second inhale. Wait 5 to 10 minutes to see how you feel with that dose. And then if you need a little bit more, have another half second or 1 second. And again, the idea is going up in very small steps to find that area where you're comfortable without unwanted side effects. There is a chance with a vape that if you did the whole 3 seconds at once, that you're going to go from like 0 to 100 as quick as you can. And that's very uncomfortable.
Sure, that's really there. So let's talk a little bit about terpenes. I know this is a very busy slide, and I really don't want to go through all elements of it, but I think the important part is to understand that each of these terpenes has a different property that can help you with pain and inflammation, mood, that type of thing. And they're also very sensitive to temperature. This is really, really critical because when you're, for example, when you're vaping, most vape pens will have 3 or 4 settings. It's important to set the setting on the lowest setting. For example, if you're trying to use things like myrcene, for example, or linalool.
Certainly. And this is why knowing what terpenes are in the product that you're using. So if I'm looking for something that's going to elevate my mood, I might be looking for products that have limonene or linalool in it, or even terpinolene. It's finding those terpenes that are specific to what you're trying to treat. That's really what drives a lot of the benefits from cannabis is the terpenes.
Right. And notice most of these say low or low to medium heat. I think that it's key that when you're going to look at inhalation, get a vape pen or a device that lets you set the temperature. Because if you take that blunt, you take a joint, you put that 500-degree temperature flame to light it, you're going to burn off most of the cannabinoids, almost all of your terpenes, and a lot of your flavonoids. You're going to reduce the medical efficacy quite a bit. But by using a vape pen with a temperature setting or a concentrate with temperature settings, you'll be able to get the maximum relief from your inhalation product. So let's talk a little bit about the timing. I know in my particular case, I have herniated discs in my neck. It's not going to go away. I've got to have something that works all day. And a lot of people ask me, what's my regime? And I think this is important because what I do when I wake up in the morning is I have a vape pen. I will take one of those hits right away to really get rid of the pain almost immediately. You had some comments on the word hits, right?
Yeah. So hits, it's just another word for a dose. And again, it's finding that low dose that works well for you. Mm-hmm. Again, start with like a half second or 1 second inhale. Right. Once a patient is more experienced using a vape pen or a concentrate pen, they're going to figure out what the timing is for that hit or that dose for them.
Right. And then then what happens is I keep the pen with me. I don't necessarily need it just in case, but also in the afternoons and in the evenings, I use tincture oils to be able to, again, I might get about 4, maybe 5 hours. And so I have to make sure I'm covering it all day long. If I just took it in the morning only and didn't do anything later on in the day, the pain will come back. And then in the evening, I actually take a tincture oil that helps me get sleep through the night. And then also I use chocolates because the chocolate will last for 10 hours and helps me sleep through the night. So this is kind of my regime that I go through because I have to cover 24 hours a day. I wish I had a condition that I could only take it in the morning, but unfortunately that doesn't go away. You see that quite a bit where covering the entire day is important.
Absolutely. Especially with things like pain. It's not going to go away unless you're treating it, and that includes while you're sleeping. Is your pain waking you up while you're sleeping? Okay. Right. So let's look at a product that's going to help you with staying asleep. Right. If you are having pain when you first wake up, okay, let's look at an immediate use product like a vape that is going to give you the relief that you need right then. And then maybe taking a tincture to give you a little bit longer relief. And then looking at when you're going to take your next tincture dose based on how long your tincture lasts for you.
And it's really key. You really need to personalize it. The nice part about cannabis is once you identify your therapeutic level, once you understand your tolerance to THC, by experimenting with the amount of CBD, you will personally feel much better. Your body will tell you. There's nothing that a doctor really can't prescribe things. Your body will tell you when you're feeling good, and it'll tell you when you're not feeling good. And then you can like I did, I wrote this down, what worked for me, and then I just follow it. Now I do where I have the 1-to-1 tincture oils I talk about here in the afternoon and evenings. I do sometimes go to a higher concentration of CBD. especially lately. I've been the last month or two, I found that really helps quite a bit. So it really personalize it. That's the key to dosing. So Amy, we talked about a lot of subjects with respect to dosing. This is really important, and I can't stress more. Personalization is really the key. What's your final thoughts on this?
Yeah, just remember, start low, go slow, be consistent with journaling, especially in the beginning. It's going to give you a lot of really helpful information about how products are working for you and also how long they're working for you. And then you can you can use that journal to help build a regimen for that whole 24 hours.
Right. This is not complicated, but it is a matter of doing a little bit of experimentation. It could take a week or two to really get it right. But I can tell you, once you feel it, once you see it working, it makes a huge difference. I'd like to thank you for watching this video. Naturally, follow us on social media. You'll find copies of this video and other videos at our YouTube channel, Marijuana Aware. And naturally, each week we have our Marijuana Aware webinars on Wednesday nights. Please join us for the different webinars that come out there. Thank you for joining us, and we look forward to your comments.